What many of us don't know is that the bone is a very active organ. Let's say you're 60 now. You may have lost 30 to 40% of your bone.
Is that why we grow shorter and we hunch?
Not everybody, because osteoporosis, and that's what we are talking about today. Osteo is bone, porosis is like a honeycomb appearance in the bone. Osteoporosis is something that slowly develops and is a silent disease. So you may not even know you have it until you have lost about 70% of your bone.
What am I standing on? Is that the only thing our bones need? Just the calcium? Do you need
But
something
you
else?
need to get that calcium into that bone. So you need to have that GPS directing that calcium into the bones.
So what do I do with
That's
that?
the vitamin D. All of us need to lift that butt off the chair and we need to move. We need to walk, we need to stretch, we need to keep our bones healthy.
You heard the woman! Hello! My name is Emmy Abdul Alim and I'm co-founder of Menopause Care Alliance. We're an independent, non-profit organization based in Singapore. This podcast is part of the work that we do to help more women live healthier, stronger lives as we grow into our 50s, 60s, and older. In case you haven't already guessed from what I'm wearing, we're talking about bones today. See, not Halloween, bones. And we have with us a leading gynaecologist and specialist in menopause care, Dr. Premitha Damodaran, who has 30 years of experience in women's health. We'll hear from Dr. Premitha why women are more prone than men to fractures, how we can keep our bones in shape so we can move freely and independently for as long as we live. But before we get to Dr. Premitha, I want you to do something right now. Okay, stop for a second and think about this. In your mind, you are 80 years old. What are you doing? How are you feeling while you're doing this? And then who are you with? Okay, do you have that picture in your mind? Whatever it is, just have that picture of you, what you want to be at 80 years old, how you're feeling doing it, who you're with. Hang on to that image, and let's get into the podcast, and we'll deal with that, achieving that goal. Dr. Premitha.
Hello, Emmy. I love your costume, by the way.
What costume?
That one that you have on you.
This one is called Today is Thursday.
Okay.
It's just another day lah.
Well,
But
I wonder what you wear on Friday and Saturday and Sunday.
That's another podcast story altogether.
All right.
But I thought that it was very anatomically correct
For today's topic.
And we can get into it with the bones.
Absolutely.
But first, let's tell people why we're doing this for women. Because if you just think about it as a layperson, why would we have a dedicated podcast about women and bone health when we as human beings, men and women, have the same bones, and then we age, and then due to aging, we all fall and maybe get fractured, right? So we're doing this because there are very specific factors that contribute to osteoporosis and bone health that affect women specifically compared to men. So we're doing this, and I will have to read it out because the statistics are quite stark. So bear with me. So we're doing this podcast because women are more prone than men to weakening bones and fractures, and the risks are not abstract. In Singapore, over the last 30 years, hip fractures for people 50 and older increased 5 times for women, compared to 1.5 times for men. That's huge. Losing mobility and strength is serious. About 1/3 of people 65 and older have suffered a fall at least once, and 40% of these falls account for injury-related deaths. So that's bleak. That's Singapore, and the situation is similar in Malaysia.
Similar everywhere around the world. Every 3 seconds, there is a fracture happening due to osteoporosis. Anywhere in the world. Definitely much more common in women than in men, because we're not only talking about aging. Yes, you know, anything that we have, age takes over. We buy a car, the car gets older, the car runs into trouble. Our bones get weaker. That's aging. But what's special or what's scary in a woman is the fact that when she starts losing her hormones and we're talking about the estrogen hormone, when she goes into menopause, her periods have stopped, her bones get so much weaker because we need that estrogen to keep our bones alive. What many of us don't know is that the bone is a very active organ. So it's continuously getting better. And let's look at this bone. There are bone forming cells and there are bone losing cells. So it's always a continuous balance, and that keeps that bone healthy. But when a woman starts going into what we call that menopause transition, so way before that last period occurs, even 3, 4, 5 years before that last period.
And when is the average age of the last period
So
for women in this region?
Singapore is about 49, Malaysia is about 50. So around that time, and let's say after 45 or so, on an average, of course this varies from women to women, that balancing act changes. That estrogen is very important to keep that balance going so that bone remains healthy. So once that estrogen changes, there is more bone loss.
By changes, you mean the reduction of estrogen, yeah.
But that equilibrium changes when you go into perimenopause.
Wait, does the bone stop growing at some stage in terms of strength? Because obviously it does, because we age and we feel weaker.
So that again comes back to that balancing act. So the balancing act, you are losing more bone. So definitely bone strength changes because now you got more bone loss. So not enough coming in, but there is more out. So that compromises your bone strength and your bone health. And so slowly along the way, more bone loss. And then what happens is that, let's say you are 10 years after menopause. Let's say you're 60 now. You may have lost 30 to 40% of your bone.
Is that why we grow shorter and we hunch?
Not everybody, because osteoporosis, and that's what we are talking about today. Osteo is bone, porosis is like a honeycomb appearance in the bone. Osteoporosis is something that slowly develops and is a silent disease. So you may not even know you have it until you have lost about 70% of your bone.
What am I standing on?
So everything looks fine from the outside.
Is it like what's happening here?
Let's look at this particular picture.
Yeah.
So you have a nice, healthy bone. So you've got all these segments inside the bone which are nice and strong. They are all interlaced very well. Now you're losing bone. So those bone structures inside become thinner. And then that interlacing becomes lesser. So this is what we call that honeycombed appearance of the bone, or a spongy bone.
Oh.
So now you just gently fall lah. You put your hand out to break your fall, fracture dekat sini.
Wait, show me. Where is it on my
So the
bone?
fracture can happen right there at your
The wrist, okay.
You can slip, you can have a fracture of your hip.
Wait, show me.
Yep, so let's look at this bone and let's put it here. So let's look at the fact that...
This is the body of a 52-year-old woman.
Not
Okay.
bad.
Not bad. Okay, boleh lah.
So you fracture at the neck of the femur.
Here?
Yep. All right.
Okay.
And then on top of it, you can also just cough and you can have a fracture of your spine. Yep, anywhere around here. So then what happens is that the vertebrae, which are your spine bones, collapse against each other.
Right.
And then you get hunched. And that's what we call a dowager's hump. It can happen with just a gentle cough, a small fall, and you fracture. And now what the most scariest fracture is actually the hip fracture. All right? So you fracture the neck of your femur here. Unfortunately, stats show, men and women, 20% will die in that first year.
Why is that? You've just
Because
fractured a
you
hip.
are immobile, you are in bed, you may have other problems like diabetes, high blood pressure, depression sets in. So a lot of other factors come in. And out of that remaining 70 or 80%, let's say 80% of the population who survive that hip fracture, only 25% will regain full mobility.
Do you see this in your practice?
I actually see a lot of osteopenia, which is that borderline stage towards osteoporosis and osteoporosis in my clinic because of the fact that I'm also looking out for it. Because I deal with a lot of women's health, and one of the things that I always feel is important is for women to understand that their bone health is actually more important than their cardiac health.
I don't get that. But cardiac is heart, right?
Yes.
So if
but
my
the
heart...
chances of osteoporosis killing you is much more than your heart killing you.
How? No, why?
Because of the fact that your mobility changes.
Then it impacts your movement.
Correct.
Okay.
So I think it's really very important for everyone to know that osteoporosis is a real thing. 1 in 2 women will have osteoporosis in their lifetime.
So you and me are one of us will have it?
Or maybe if you put ourselves in a room of 4, 2 of us will have it.
Yeah.
Yeah. And so knowing about it is very, very important.
I want to go back to your practice because you see, we're filming this in the afternoon, and I asked you how many patients did you have in the morning, and you said 9 or 10. That's just the morning. That's a lot. So within a week, how many women do you see that are affected by osteoporosis?
I see on an average about, let's say, 70 patients a week on an average. But I can tell you that out of that 70, let me just divide it into fact that, first of all, not everyone ends up with a bone test. But I would see close to, say, 3 to 4 women with full-blown osteoporosis.
And that was the first detection when you detected it?
Correct.
How old are they?
And so they can range from 45 to 80. So now what's really surprising is the fact that I am getting to see younger and younger women because I am actually proactive in checking for it. So the best test for osteoporosis is actually to do a bone mineral density test, where you just lie down, the machine's on top of you, and it actually calculates how much of bone you have lost, and we call that a T-score. And it actually gives you a little chart of how much of bone you have lost at your hip. So we're looking at the total hip, we're looking at the neck of the femur, also looks at the spine, and it looks at the L1 level to the L4 level. So it tells you all that. It gives you a benchmark. Okay, I am now menopaused. My bones are like this. What can I do to keep it well? Or what can I do to make it even better? So I think it's really very important for that foresight to come in for all women to be aware of bone loss that happens with menopause.
Is that the only test? Because affordability is a big factor in terms of getting tests and scans done. For instance, I'm 52. I've already had 2 breast mammograms, public health system in Singapore. And with those come ultrasound following that if they detect something. So in the 2 years, I've had 2 mammograms, but no one has said anything about, oh, let's see how your bones are doing. In that case, if I cannot afford this test that you're talking about, the bone mineral density test, the DEXA test, is there something else that I can refer to that I can roughly figure out for myself?
Well, I think it's also a conversation that you have with your own doctor, because there are certain things that we can do to sort of pick up those who fall into a higher risk category. And once you fall into that higher risk category, then we can probably advise you that along the way get a test done. So then we are
Before
not
we go-
making it a routine, but
Before
we
we
are
go into
making
high
it
risk, because we do have to cover the high risk as well, in terms of the testing, there is another one that you were just telling me about.
correct. We call it the OSTA test.
What does it stand for?
So it's osteoporosis screening tool for Asians.
For Asians,
Yeah.
we have a specific tool
Yeah.
for Asians?
And it has been validated, so
Yeah.
that's great. And the most simplest way to look at it is the fact that if your weight is less than your age, you are already falling into moderate risk. So let's give an example. You
Okay.
are 55 years old
Okay,
and you weigh 50 kilos.
okay.
You're moderate risk for osteoporosis.
If I am 62 kilos and
And
50
you are,
years old,
oh, then you're okay lah.
so the weight has to be higher than the age.
Yeah, but we don't want you to push your weight up.
Okay, yeah, so this is
unnecessarily.
what I'm saying. So, okay, lah, let me be, on the BMI, it's first overweight and then it's obese. Let me be obese and then I'm okay for my bones.
Well, obese doesn't help other areas in the body, correct?
Yeah.
So obesity then comes in with all the cardiac problems, the other issues, your metabolic issues. So not a great idea. So and again, putting on weight if you are normal weight is not the treatment for osteoporosis. Okay?
Okay.
So I think it is more for us using these tools for a pickup rather than as a diagnosis. So using these tools and says, yes, but we also have to, look at that woman, what's her lifestyle like, and all the other issues that come in, and then tell her that yes, maybe a good idea that you go and see the right person or go and do certain tests that would help, define what your bone health is like.
Okay, before we go on and talk about really what we can do, because it's not a lost cause apparently, just make one thing very clear. Is osteoporosis only affecting the elderly 65 and above?
No, I just told you in the last week.
Because it's always equated with aging.
Yes, correct.
Always, yeah.
So, yes, it is an aging process that is running at the background. So that's going to affect men and women. So we are all aging, we are losing bone slowly, all right? But what happens with women is that they have that hormone estrogen that keeps their bones strong. But that hormone estrogen does not last for a long time. So once that hormone starts decreasing, and that's usually in your mid-40s, late 40s, then you start losing even more bone. So if you're looking at numbers, let's say that we're all losing bone, we lose 1 to 2% every 10 years. It's okay, fine, can manage. But at that perimenopause, menopause transition, you may be losing 2 to 3% every year. So that compounds that baseline background aging process. And that then makes that woman lose so much more bone, and thus, as I said earlier, by the time you hit 60, you may have lost 30 to 40% of your bone.
Unbeknownst to you.
Correct. Silent disease,
Yeah.
and this is very, very important.
Until now, because everyone would have heard us and then
Well, I
now
hope
we
so.
know.
I
Of
hope
course,
so.
of course. Okay. We know now what happens to the bone as we age. Hearing you, I get a bit paranoid. I'm a little bit of a hypochondriac as well. What I hear is that all of us women are immediately at risk of osteoporosis, brittle bones, frailty, fractures. Is that right?
Well, it was not meant to scare you. It was just meant to increase awareness
Okay.
that we need to look after ourselves. And I think that's so very important because of the fact that osteoporosis is more common in women compared to men.
Okay, are there particular groups of women that are more prone to it?
If you look at what we call risk factors, so who are the women who are more prone? So then I would divide that into what we call unmodifiable risk. That means you cannot change it. Woman, that's number one. The second thing is that if you menopause early, there are women who menopause before the age of 40 years old. for certain reasons, that it's already there in their biological structure, or for some reason they've had chemotherapy, radiotherapy, or removed their uterus and ovaries for some reason, and they now menopause earlier. So when we menopause earlier, our risk of osteoporosis actually increases by 3 to even 5 times more because we have lost our estrogen so much more earlier. Then comes that group of women that menopause early, that means before the age of 45, between 40 to 45. Again, that's that risk of women, that group of women rather, that we have to look after, because again, we are thinking bone loss, bone loss, bone loss. And would that woman have a higher risk of fractures later on in their lives? So, being a woman, menopausing early, less than 45, if there is family history of osteoporosis, and this is really very important because of the fact that if your mother, auntie, has had a hip fracture before, you already have a higher risk of hip fracture. Then comes the ethnic groups. We know that if you are of Caucasian descent, if you are of Chinese descent, then you have a higher risk.
Just by being
yes,
Caucasian and Chinese.
All right. And then you have the fact that if you've had a fracture in your adult life, a simple fracture in your adult life, that's already putting you into that higher risk of fractures. That means your bone's already not so good at 30 or 40. That means how is it going to be when you are actually going through menopause? So these are what we call unmodifiable, all right? Then you come to the modifiable risk, which means that it is in your hands to change your pattern of bone loss, all right? But, we are looking at body mass index of less than 19, so the really skinny ones. So we are worried about the anorexics, the really small sized girls who don't eat, malnourished young girls, teenagers who are actually needing to build up their bone at that particular time. We are also looking at the fact that your diet, too much coffee cannot, more than 3 mugs a day cannot, increases your risk.
On the bones?
Yes. It does.
But then the science sometimes says if more coffee is good for your heart.
Moderation is the answer. 3 units of alcohol per day, also not great for the bones. We are also looking at the fact that you don't take enough calcium and vitamin D, and this is really very important for the first 25 years of our lives, because that's when we are actually building bone. We want to get that good bone reserve at that point, and then we're going to be losing bone after that. So getting that calcium, vitamin D in it. We are also looking at the smokers. So if you've been smoking many cigarettes for a longer period of time, then you fall into a higher risk category. If you are what we call sedentary, don't like to exercise, don't like to move around, then you're not making your bones stronger. That again puts you at a higher risk. So all these are risk factors that actually can be changed by moving, cutting down the cigarettes or zero cigarettes, coffee in moderation, alcohol in moderation. So these are what we call modifiable risks. So now it is more the fact that what's done is done.
Okay.
Now what can we do moving forward? We need to start with the basic ABCs.
Okay, what's the A, what's the B, what's the C?
So it's more like 1 to 3 rather than ABC. So I would say 1 is movement, 2 is diet, and 3 is supplement.
For that, I think we should maybe do the movement instead of being sedentary.
Absolutely.
And because of that, we need more space, so let's go over there.
Let's do it.
We are doing moving. It is raining outside, so we move inside. So is this considered part of my walking regime every day if I walk indoors?
Absolutely. So the idea is to move. So let's walk. And so you walk, you can either walk on the spot.
Yes, like this.
Or you can walk across the sitting room, dining room, have that pathway drawn up and walk.
How much walking do I have to do?
Well, it all depends on what your baseline walking is all about. If you hardly walk, then you might want to walk 15 minutes a day.
Okay.
Okay, so if you are used to walking, then you want to increase that a little bit. So what's your baseline? And then improve on that.
So this is good lah.
So this is weight-bearing exercises. So you're moving your weight from one leg to the other. So this is
Okay.
excellent. So this is part of it. So, you can do 10 times and then do it in repetitive about 3 to 4 times. But again, I spoke about consistency. So you have to do it regularly. We're looking at building up your muscles. So your muscles become so important because it is holding that bone together. So squat, go down,
Okay.
count till 5, come up.
The good thing about being in KL, ladies and gentlemen, is when you go public toilets, there's squat toilets.
Well, it's easy to go down, but can come up or not? You're good. But
No,
let's
not bad
face
lah.
it, some of us cannot. So again, what is comfortable for you?
Yeah.
What can you do? And then go from there. So I wouldn't want anyone with a knee problem squatting down and actually causing more problems. And sometimes we just use things at home, like you can use the wall behind you. Look at that book rack. Let's
Okay.
see whether you can do some resistance training there. Come.
What does that mean? Do I
So-
pick up the books?
No, basically you go to the wall,
Okay.
maybe reach that wall, and then go back 4 steps.
2, 3, 4.
Okay, maybe go back a little bit more.
5.
Yeah. Now, keeping your back straight. Always remember, keep your back straight. Lean down, touch that, and then come up. Keep your back straight.
Is my back straight?
Yes, so sometimes now you're arching. So go back straight, go down, come up. So again, 10 times, doing it in about 3 to 4 reps every time. You can actually, as you get stronger, move yourself back. And that would be even better. Yeah,
Yes, you feel it.
Yes.
So instead of doing this, why don't I just do push-ups on the floor?
because some of us can't carry our weights with that wrist.
But is it a goal that we should be able to do that?
Nope,
Push-ups?
not at all. Do what you can at your level. And that, I think, is more important.
And then finish.
Oh, well done. Good for you.
That's it?
Well, again, we're talking about being consistent with your exercises. We are building up muscles, right? So it's not like, oh, you do 40 minutes today and then gung-ho, everything is okay. So you've got to build it up because, again, we're trying to avoid muscle injuries, joint inflammations. So building it up slowly in the correct way is very important.
What can I do if I don't have the time? I'm like at the desk for 6 hours.
Okay, let's get you to sit down.
Okay. Bagus.
Okay, so put a timer on your watch. Maybe every 20 minutes or so, get up, straight back, sit down again.
But this doesn't feel like exercise.
Yeah, but it is still moving your body. So if you do that, it actually helps you with your whole back.
Okay.
And it actually also, every 20 minutes you do that, maybe 5 to 10 times, again, is weight bearing. And it helps you build up your muscles. So very important.
So do I need fancy things like buying dumbbells and machines?
Well, I think we need to start at basics first, and this would be basics. And then once you're comfortable with all this, then you can go on to gadgets. And I think dumbbells are great. Resistance bands are great. Again, with advice, because sometimes we do it wrong, we get into trouble.
Okay. I've done my fill for 1 week lah, like this.
No, this is probably just for one day.
Okay lah, we see. Now we go and talk about diet. Let's go.
Let's do it.
Now we sit down and we talk about pillar number 2, which is diet and nutrition. So we have this basket with us. Take us through this.
Let's look at just a few things that anyone would associate calcium with. What would be the first thing that comes to your mind?
Milk.
Yes, milk. So the first thing that we would associate calcium with is milk. What's the second thing that comes to your mind?
Milk. Another time. Yogurt.
Yogurt. Then
Yeah.
we have the cheese.
All
we
the dairy
have-
products.
Yes. So
Okay.
then we have the Malaysian or Asian products like the tempeh, we have the anchovies. So just let's look at the common foods that we have.
Okay, in this basket.
So, yeah, some of them are in this basket. So we are going to the grocers, and then we have this whole array of milk products, and all these milk products. And this too depends on us, right? Some of us, as we get older, we cannot take too much of lactose, or we are worried about the fat content in the milk. So what is most important, is that we need to learn how to read labels.
Okay.
So many times in that milk, it might say fortified with calcium. That means we know that that milk product has got extra calcium. If it doesn't say anything, that means that that milk product does not have extra calcium in it. So reading labels become very important. So we need to have good eyesight too, yeah? Because the labels are very, very small. So the trick is take a picture on your handphone, make it bigger. And you can actually see how much of calcium there is in a serving. Then we have to look at what is that serving. That serving may be a cup, that serving may be a glass. And that glass is usually 250 mils. So generally, as I said, when we are looking at high calcium milk, one serving or one glass on an average may have 500 milligrams of calcium. If you're looking at just the full cream or the non-fortified milk, you're looking at about 220 to 250. But many of us actually don't drink the whole glass of milk, We just champo in the coffee or tea,
Yeah.
So again, calculating is very important.
So how much milk do I need?
So calcium is best from diet. We need about 1,000 to 1,200 milligrams of calcium every day.
So how much milk is that?
So that means if you're looking at that high cal fortified milk, 2 glasses full.
That's doable.
Really?
Except that I'm lactose
Every
intolerant.
day. So now that you're looking at the normal full cream milk,
Yeah.
it's 4 glasses. But full cream also carries fat. So again, it is that balancing. So of course now we are looking at the fact that can we achieve that kind of calcium? So now let's look at cheese. Again, read the label. 1 slice of cheese, how much calcium does that carry? Calculate looking at the labels at the back. Now, let's say that we want to look at the tofu. Again, read the labels to see how much of calcium content there is. And then you modify accordingly. The best is actually your anchovies or your ikan bilis. So 2 packets like this is 1,000 milligrams of calcium.
Which is what you need in a day.
Which is what you need in a day.
So you eat
now,
like this lah.
Every day can
Can. Pizza, kangkong, nasi goreng.
Okay, I wish you all the best because I don't think that's going to be possible.
But you mix and match lah. You have the milk,
Correct.
you have the cheese. Yeah.
So, but the reality is that not all of us are going to achieve that.
Okay.
But most of us, on an everyday basis, may be able to hit 600, 700. So then you need to add on.
Is that the only thing our bones need? Just the calcium? So when I go and buy stuff, I'm just looking at calcium for my bones? Do you need something else?
But you need to get that calcium into that bone. So you
Right.
need to have that GPS directing that calcium into the bones.
So what do I do with
that's
that?
the vitamin D.
Okay.
So that
D.
vitamin D actually comes from sunlight. Unfortunately, even though we are in this Asian part of the world and so-called sun is always there with us, to be honest, 80% of us are vitamin D deficient. Because we don't like going out in the sun. I'm guilty of that myself. I come into work in the morning, I go back in the evening, I'm not there in the sun, all right? Even if we go into the sun, we carry an umbrella because we don't want that, the rays to hit us, or we are wearing long sleeves
And
or
we
the
cover,
hijab.
yeah.
So we don't get enough sun.
And sunblock?
Yes, sunblock. Sunblock takes off 95%.
If I do my daily skincare, maybe there are 7 layers, and then you put sunscreen. How is my vitamin D absorption with makeup and sunscreen?
95% does not go in.
So wasted.
Wasted.
So I look
but
great
good
lah.
good for the skin.
Okay lah.
Good for the skin. You're looking after your skin very well. But vitamin D is made on the skin. Huh? The sun rays actually change certain cholesterol particles on the skin, and that's how the D is made. So then that D gets into the body, into the liver, into the kidney, gets absorbed, and that's how it then takes that calcium and pushes it into the bones. So very important for that balancing act. So if you have enough calcium in your diet and with your supplements, and then you don't have enough vitamin D, it still won't work. You
How much
still
vitamin D do we need?
So that's that golden question. So ideally, you can do a blood test, and then you can actually find out whether you are insufficient or you are deficient, and you can go from there. And that's one of the easiest way of going about it. So we talked about movement, which we've just done. We are now talking about the fact that what are the foods, and then we move on to the supplements as such.
Okay. So in terms of supplementation, if I take calcium and I take vitamin D, then that's enough for my bones.
Partially enough.
Partially enough? Is there something else that I need to do?
Of course. Because now you want to impact your bones and make it stronger. So it's not all about
So again,
just
movement.
Diet. Again,
so
movement.
we need the whole thing, the holy trinity of good health.
Correct.
Movement,
so
diet, supplementation.
Yep.
That takes up a lot of time, Dr. P.
No, because diet should be part and parcel of what you do every day anyway. And you're moving. So now we're teaching you how to move right.
Okay, so this is a real question, eh? Not that my other questions are not real, but this really is something that I'm thinking. My real question is, calcium, vitamin D, because I don't get enough from my diet, why not I just take multivitamin?
Okay. So when you take multivitamins, which is great, yeah? I think multivitamins are great because it's got a little bit of everything in that one tablet. So shortcut lah this one.
Yalah.
So you just
Save
take
time.
that. So we always look at calcium from diet first, and then you take the extra that you need. All right? And calcium is also best, if possible, taken as a divided dose. So say that I need 800 milligrams of calcium. So you take like 400, better absorption.
Do you mean at different times of the day?
Different times of the day.
Okay.
And you always hydrate yourself when you take calcium tablets. So always have to drink lots of water. So all these things actually play a role. So no need to take too much. We take correct amount.
For the vitamin D, do you need to also divide that?
No. Vitamin D is a fat-soluble vitamin. Usually best taken with food. All right?
Any kind of food?
Any kind of food, but always better the more food. Don't just take it with just a protein diet, because you want that fat inside that diet too. Okay?
So carbohydrates?
Carbohydrates might sound so much better. So now, vitamin D, you can go objective because you can actually measure your levels, and then you can see how much extra that you need. You can actually take up to 4,000 IU a day, international units a day, quite safely, but we always monitor. Again, we don't have to do too much. We just do what's right.
How do I know how much vitamin D I need?
Blood test would tell you.
Okay.
And then let's say, depending on whether you are deficient, then we try and push you up much faster. If you are insufficient, then you can go, do this gradually, and then you can check your levels again after 6 months, see where you are, and then you can slow down or continue and then go from there.
Okay, we've covered a lot. Can we do mythbusters, because we sort of know a lot of things coming from everywhere? Let's just do this and get it over and done with. Okay? This is the answers. Okay, true or false? We get enough vitamin D from sunshine.
False.
False. We do not get enough vitamin D from sunshine.
Well, it depends on the sunshine and how long you are standing under that sunshine.
What time sunshine?
Midday.
12 o'clock?
11 to 2.
11
That's
to
the best
2.
time. And then again, depends on whether it's it's a really shiny day, or you've got clouds there that are blocking that sun rays. Whether you are adequately dressed, there is more skin that's going to absorb the sun rays. So a lot of other things that actually matter. And unfortunately, the darker we are, the sun does not get through so easily. So the fairer skin actually better.
Yes or no, I need supplements if I eat a balanced diet.
Depends on your body's absorption. So balanced for you, but how much is actually getting into you, number one. That means your absorption rate. Number two, what is your body like? We need to know what's your framework like. We need to know what are the deficiencies you may already have. So for example, you may be what you think healthy, but you may already have a higher risk of osteoporosis. You may already have vitamin D deficiency. You may have lesser iron because you're bleeding heavily during a period. So would that balanced diet be sufficient? So we need to always calculate input, output, whether it's enough, and then go from there.
Okay, last one, true or false? Drinking milk every day, for example, in my tea or kopi, just like this, is enough calcium for my bones. And also if I take alternative to animal milk, oats, almond, soya, which is very popular.
So again, read labels, all right? We mentioned just now that you actually need a full glass of milk, and depending on what milk that you're having. So if you're having calcium fortified milk, that full glass might be 500 milligrams. Good, but you need to drink the whole thing lah. But if you're having just the skim milk or the normal fat milk, it might be 220 or 250 milligrams of calcium. So again, reading labels, calculating your calcium that you need every day becomes more important.
So we're clear now about why women are more prone to osteoporosis and fractures. We know what we can do to keep our bones healthy. We need to move, exercise, do weight bearing, resistance, get enough calcium, vitamin D, either through diet, firstly, or if not enough, we supplement, right? If we've done all those things, do we need to still go and talk to our doctors?
Oh yes, because you need to know what your background risk is like. You need to know whether you're falling into a higher risk category. Remember, I spoke about the modifiable, non-modifiable risk factors. So I think having that chit-chat is very, very important. The doctor would check your weight. They would look at your family history. They would look to see whether you are absorbing your supplements or your diet well. So a lot of that talk that comes in actually individualizes your treatment and makes it better for you. So talking to your doctors are very important because we are looking at it from a totally different perspective. You are looking at it just from diet, exercise. We are looking at, okay, how do I keep this woman healthy for the next 20 to 30 years of her life? Keep her moving well and cut down the frailty.
What kind of doctor should I go to?
Well, actually, it can be any doctor that you can relate to. So it could be a family GP that you've always been talking to. It could be your gynaecologist who's delivered your children and you're very comfortable with him or her. It could be your physician. So initiating that conversation is, I think, the most important thing. And also trying to, if you feel that that doctor is not comfortable talking about it, always ask that doctor, is there anyone I can talk to? Would you recommend someone that I can go and see to make my bone health better?
Because we're in this region, a lot of us seek alternative treatments. What if I want to see a Chinese traditional medicine doctor? What if I want to go to do my traditional jamu? Or I know a lot of women who do Ayurveda as well. Do any of those things help specifically with bone health?
Unfortunately, no. And I'm not downgrading any of the things that you mentioned because I just feel that this complementary medicine also works to keep us feel better. Sometimes the jamu, the Ayurvedic medicine, your blood flows much better, your system is regulated much better, but it may not help bone. So when you're doing all this, you add on other things for bone health, everything works so much better.
Okay, the last one. What is your top message for women? What do you want to say to them now about achieving their goal of that 82 years old, doing a road trip across, pick a country, Morocco? Doing a road trip across Morocco, freely walking independently with her besties.
Move. All of us need to lift that butt off the chair and we need to move. We need to walk, we need to stretch, we need to keep our bones healthy because that's the essential part of us. So movement is really very important because movement will impact bone health positively. It will impact muscle strength positively. So if we can do that, we have already gone in a very good direction.
You heard the woman! Let's get moving.
Yes, let's get moving.
Okay, Dr. Premitha, as part of this podcast, we reached out to groups of women and we received quite a lot of questions. We've picked out 6 that we think would cover and help a lot more women in the general population. The first one, this woman is of Indian ethnicity. She lives here in Kuala Lumpur. She's in her early 50s. She is premenopausal. She asks, is the musculoskeletal pain and stiffness related to the hormonal changes of perimenopause or menopause? Or could there be another underlying condition like a new onset of osteoarthritis or an inflammatory issue?
When we are going through the menopause transition, we are losing estrogen. And estrogen, we talked about the fact that it's really important for bone, for prevention of bone loss, right? When we lose estrogen, we get more bone loss. But estrogen is also important at that joint area. So 2 bones meet, you have the joint. You have fluid in that area. You have the cartilage. So all this is very important for that joint health. So now we're moving from bone health to joint health. So estrogen loss also affects those joints. So the fluid comes down, the cartilage gets thinner, so you have the 2 bones now meeting each other. So that already sounds painful. Inflammation also increases when you are losing estrogen. So an inflammatory process starts. So then you have something else that's called osteoarthritis. So when we have OA or osteoarthritis, then again, it is a progressive problem. So, you get to see someone, they might give you some injections into that joint to actually improve the fluid in the joints. You need to exercise correctly. So musculoskeletal disorder of menopause is actually a big syndrome by itself because of the fact that the fluid comes down, the cartilage gets thinner, the tendons gets affected, the joint health changes. More joint pain. More inflammation.
Okay, now we have a question from a Caucasian woman. She is in her mid-50s. She is a breast cancer survivor. She was diagnosed with breast cancer after menopause. Her question is, the main information I've been given about my bone health is to take calcium pills and do weight-bearing exercises. I'm also getting an infusion of Zoledronic acid every 6 months. Anything else I can do?
So I think she's already in a good path because of the fact that she's been told to look after her bones, which is great. So she's on breast cancer treatment. Sometimes that can affect bone health. So her doctors have actually, pointed her to take the calcium. I would add vitamin D to that. So again, looking at diet first and then supplement. And then she's on Zoledronic acid, which is actually it increases your bone density.
Can we just take it
no
without...
need lah, not everybody
why
lah.
don't I save myself the trouble of daily calcium and then just every 6 months lah, Zoledronic acid?
Okay, so this is how it works. Say you're diabetic.
Okay.
I give you diabetic medication, not enough. I need you to look after your diet. I need you to exercise. So that's your calcium and your vitamin D. So we need to do everything together.
So no silver bullets?
No shortcut.
Okay lah. Another breast cancer survivor. Early 50s, survivor of 2 breast cancer diagnoses.
Wow, amazing woman.
She's mixed race, Chinese Malay. Her menopause was induced after her 2nd breast cancer
Absolutely.
diagnosis. The question is, are phytoestrogens, soy or supplements, safe for me? Are weight-bearing exercises safe for me? Which ones are best? Did the treatments I received for breast cancer, example, aromatase inhibitors like Letrozole, radiation and steroid use, weaken my bones?
Okay, so one by one, she's had breast cancer twice. That's the most important part of her. And that's, she's overcome that. So that's wonderful. Of course, it comes with certain effects on the body. So we are looking at the fact that she was on steroids. So yes, that can change a few things. She's on medication. So now we look at, yes, she's positive with her health, but what the medication has caused, we now treat that separately. So we don't look at the breast cancer anymore.
Okay.
Now we look at the fact that we look after her general health because she's had menopause induced. And I have no idea when that was induced. So that was induced earlier than time. So then we have to look at 3 areas.
After the 2nd diagnosis.
Yeah, but we have no idea when that was, whether it was in the
Okay.
30s or 40s, So she's cut her estrogen, has the estrogen stopped earlier than what we would like.
Okay.
So that means that we have to look at 3 areas: the heart, the bone, the brain. All right? So long-term health for these 3 areas are very important. Today's topic is about bone health. So again, going back to the basic: calcium, vitamin D, getting her bone health checked, getting her bone density done, which I'm very sure her breast doctors would do or her oncologist would do, and then going from there. So yes, drugs can have effects, but we know how to go about it and we now know how to look after. But phytoestrogens or plant-based therapies, they may help with a few of the menopausal symptoms, but it actually doesn't work for bones. So taking 1 kilo of soya every day is not going to help you so much with your bones. So it's still coming back to the basics of calcium, vitamin D, moving, and then seeing what else that you actually need.
She did ask about the moving, what kinds of weight-bearing exercises are safe. I'm going to assume the breast area has been affected, so hence...
Actually, even if you've had breast surgery and you've taken out the lymph nodes, we're also still asking you to do hand movements because you want that lymphatic flow, because otherwise you get swelling. So we're still asking you to do exercises for your hands, which is really very important.
Anything for the chest? Is it too dangerous?
So under advisement.
Okay.
So I think working with a physio or a trainer who is used to breast cancer women, because I have no idea whether she's had 1 breast or 2 breasts affected. So all these things actually matter. Working with a trainer and then, looking at 2 aspects. One is the weight-bearing exercises, and then you're also looking at muscle strengthening or resistance training.
You spoke about diabetes. We have a question from a Malay woman in her late 40s who has type 2 diabetes. She asks, how does my diabetes impact my bone health and recovery, especially because last year I tore my meniscus and had surgery? And what can I do now to stay strong and mobile well into my 80s? She wants to join me in my road trip lah.
So, bone health, meniscus is joint health. So the
What's the meniscus?
The meniscus is all those ligaments and that area around your knee.
Okay.
Yeah. So it's around the joint. Okay, and especially we're talking about the knee area there. So that's joint health.
Okay.
So that usually gets affected due to wear and tear. All right? Or you fall down and then you hurt your meniscus. So that's where it gets affected. So I think we're looking at 2 different areas here. So bone health would be the bone strength as such. Again, moving on, first of all, diabetes. Does it affect osteoporosis? We know that there are different types of diabetes. We have the type 1 diabetes and we have the type 2 diabetes. So the type 1 diabetes has got more association with bone loss. Type 2 also can have, but lesser. But we also know that it depends on what's actually caused their diabetes. Are they non-sedentary and, thus not working on themselves? Or, again, we're looking at a whole host of factors, and you have to look at that woman as a whole. So yes, diabetes can cause bone loss, but we also have to look at other risk factors in that woman and to see whether those other risk factors cause a compounding effect that increases her bone loss. So what she can do is get herself to see the correct doctors, get herself evaluated. So we're looking at her bone strength, we are looking at joint health. So two different things.
Okay. The last question is from a Chinese woman, no mixed races, just Chinese woman. She's in her early 50s. She is in perimenopause. She says, I have heard that Chinese women are more prone to hip fractures compared to Malay or Indian women. Do I need even more calcium and vitamin D than my Malay or Indian women friends, or more than what is recommended? And what else should I be doing for my bone health?
I think it's that fundamental bit of what we've been talking about. First of all, no need to be so kiasu. I think we now need to look at calcium in diet and just add on however much extra that we need as in terms of supplements, if we need the supplements. If we can achieve it with diet, well and good. So no need to do too much. Get that vitamin D in either through sunlight or through a tablet or supplement, and move. And again, I'm going back to moving. We need to move. To be very honest, we are not moving enough or we are moving too much and we are moving wrong. So we now know that women, as we get older, we talked about cardio health and, reaching that peak optimum heart rate. And now we know that we don't actually have to do that. We are looking at more resistance training, muscle building exercises, which are more beneficial for the older women. So we're looking at all that strength, which is actually more important than the cardio kind of exercises. So mixing these exercises is very, very important. So we also have, all the guidelines from international societies that tell us, you need to do 3 hours in a week. But if you don't do anything and you do 1 hour is already very good. So you don't have to, I'm only doing 1.5 and now I want to hit 5 hours. No need. Because you also need to understand that you might injure more. So getting that moderate kind of activity into you, very important. But what's so much more important is consistency. Because no need 1 month do, then the next 2 months no, don't do, cannot, right? So you need to keep going. So that's why I don't want them to do too much. I want them to do what's comfortable for them, but they need to keep going day after day, week after week, month after month, because that's what helps that bone and that joint.
What about rest and recovery?
Yes, so again, what's comfortable for you? So if you go and do all the mega resistance training and you're out for 1 week, no need lah. You should recover within 24 hours, So if you're doing all those exercises and you're taking a longer time to heal, that's not you. Why do you want to push and injure yourself more? So finding that balance is very important.
We have a last question. If I reach 40 years old, congratulations, you've reached 40 years old, and I start looking after my calcium and vitamin D, would I avert osteoporosis?
What we need to know is that we are building our peak bone mass or the bone reserves in the first 25 years of our lives. After that, you cannot reach the peak bone mass already. We are losing bone. So let's say 25, next 2 decades, you may lose about maybe 2%, 3% of bone because it's a slow, gradual decrease. Then menopause transition hits, then you're losing bone faster. So if you hit 40 and then you suddenly say, I want to now build my bone, cannot. It does not work. It does not prevent osteoporosis. So what we should be looking at is our younger boys and girls. And we should be telling them, go out in the field, get that sunlight in you, take calcium-enriched foods, run around, play games, because that's going to get them to achieve a higher peak bone mass. It's like your reserve bank. And then when we start losing bone, we have enough reserve lah. So we lose bone, we don't feel it so much. And so that hopefully we build that up. So even if we lose bone faster at menopause, it will take us many decades to actually reach osteoporosis.
Thank you, Dr. Premitha. We covered a lot of ground with those questions. And I'm sure that if other women have questions, send them over our way. You know where our socials are. And you can always ask Dr. P those questions.
Absolutely.
We can also they can find you directly, can they?
They can.
Can they stalk you? Are you easily accessible?
I hope they don't stalk me, but I am accessible, right?
So if I Google you, we can just reach you?
Absolutely.
Okay, let's do that. Thank you, everyone, for staying with us in this podcast right till the end. We hope that we've impressed on you about the importance of keeping your bones healthy and that you've learned how to do that for yourself. If you want more information, you can find us on socials. We're on LinkedIn, IG, and Facebook, although we're not so active on Facebook, but can also. And then please go and stalk Dr. Premitha Damodaran because she loves to take care of you. Okay? As we finish this off, we're not going to be talking about bones anymore. Maybe we'll do another one, but we'll see you there and suggest something else for us to do. And in the meantime, thank you very much again. And keep healthy. Now that you've heard all that, and you know how to keep your bones strong, how do you see yourself at 80 years old? Remember that visualization exercise we started out with? What are you doing at 80 years old? How are you feeling? And how are you moving around? Keep that all in mind, and let's keep our bones strong!